Hi, I'm Dr. Siegfried, and thanks again for coming to my YouTube channel where your health matters. Today we're going to discuss the back and neck problem in our civilized society and what you can do for it. You see, the problem is that studies tell us that the population, the majority of the population, about 80% of the population, suffer with back and neck pain and headaches. And also, chiropractic adjustments or manipulation, according to these studies, is the most effective treatment for back and neck pain of mechanical origin. Mechanical origin meaning that you might twist your neck too much, too fast, you might sleep on it wrong, you might get in a car accident, playing some kind of sport, something like that. That's what's called pain of mechanical origin. And what this means is that when a bone in your spine is out of alignment, like here, pressing on a nerve, what happens is that the nerve supply to the muscles in the back or the neck can cause pain, burning, numbness, tingling in the neck and or the arms or the legs, and if it's bad enough, even weakness. But that's not all. The bone pressing on the nerve, this nerve here, also interferes with energy going to your internal organs. In fact, Dr. Windsor, a famous medical doctor who showed conclusively in his studies in the early 1900s that when a bone in your spine is out of place, that your organs don't function as well. What that means is, as a result, you may have high or low blood pressure, immune system problems, digestion, elimination, joint pains, lower energy, sleeping problems, and the symptoms go on and on. The symptoms can go on and on relative to the nerve in the back that's pinched to the organ system. But even to look at it more simply, it's like this: when a bone in the spine is out of place, putting pressure on the nerve like this, it's like driving your car around with the brakes on. You have less power, less energy, and things don't work right. So, but to overcome that, what we do is we keep pushing. We just keep pushing all the time. But again, you've got the pressure on the nerve, and it's like you're driving your car around with the brakes on. So what's the solution? Well, the solution is specific chiropractic adjustments, specific exercises, specific traction maneuvers, specific organic, untreated whole food concentrates that we use, which most of the time will relieve the pain from the pinched nerves, letting you resume your normal daily functions. No drugs, no injections, no surgery. In fact, the recent studies have also shown that when a bone is out of place for too long a time, the ligaments which hold these things together slip. And what happens is you can actually have this is the disc will slip or herniate and put pressure on the nerve, causing numbness, pain, tingling, weakness in the neck or the back. And then there's been MRI studies that have shown that chiropractic adjustments help your body make lasting changes in as little as 3 months. No injections, no drugs, no surgery. And these are referenced in two very particular health journals, research journals on the spine and the nervous system. But in these studies that were done with the chiropractic adjustments, which was fine, there was nothing said about diet, exercise, traction, or whole food supplementation. And I think that at least in my practice, when I employ them, it's not uncommon for people to get relief even sooner than that, even sooner than the 3 months. Again, no drugs, no injections, and no surgery. So in my practice of over 30 years, about 80% of my patients will not only get relief, but be empowered to begin living their life again without pain, so long as they follow the protocol or the instructions that I give them at home to follow. And these instructions simply help them feel better and live their life more on their term. And so they can do what they want. Does that sound like something you're interested in? Because you don't have to suffer. You don't have to suffer with severe or nagging pain. But you do have to do something. And the longer you wait, the worse it gets. Energy going down, etc. Like I said earlier, if the bone is out of place long enough, your disc will slip or herniate, and you don't want that. Driving around with the brakes on, bones pushing on your nerves, pain, inflammation, swelling, and muscle spasms don't have to be a daily thing for you. And of course, as most people find out, taking painkillers and muscle relaxers to relieve your pain doesn't work very long or work very well. It simply masks and blocks the pain for a while. So when patients come to see me for the first time in my clinic, I always let you know if chiropractic care is for you. If it isn't, I simply refer you to a doctor that I would go to myself or send a family member to. chiropractic care can help everybody in pain, but it's a good place to start. And I always tell my patients this, and I tell them to tell themselves and a family member, make chiropractic care your first choice and not your last result. You can call me today if you'd like to see if chiropractic care is for you. 503-472-6550 is my number in McMinnville, and we can get you scheduled to see if chiropractic care is for you, to help you get back on your back on a path of health. If you'd like to come to my Portland office, it's 503-977-0055. I also have a website called OregonWellnessCare.com for more information, including the references to this talk today. I'd like to thank you again for listening and watching. I look forward to hearing from you soon, and you're watching and listening to my next YouTube video on Your Health Matters. So have a good day, and we'll see you on the next video.